Hello, today we are going to study about metastases. Metastasis means spread of cancer to other organ from their native site. And the most common route of metastases are lymphatics and hematogenes. Most of carcinomas spread via lymphatics and most of sarcomas spread via hematogeneous route. What are carcinomas? Carcinomas are a malignant form of epithelial cells. And what is sarcomas? Malignant form of mesenchyma. But if you are present to carcinoma that spread via lymphatics, but here exception of all carcinomas, they spread through blood. First, one is follicular thyroid carcinoma, choriocarcinoma, prenasal carcinoma, hepatocellular carcinoma. The most commonly metastases are happening in bone, liver, lung, brain, and these are more common for the primary malignancy in this organ. And metastases often appear at multiple lesions. But primary tumor having solitary terrain. For example, in this organ of we have cancer, and this is a single plain nerve cancer. But when it is going to metastasize to another organ like lung, it will give multiple lesions. Okay? Now we have to talk in detail about the site of metastasis. First, the bone. In the bones, the most commonly cancers are going to bone and spreading to bone and prostate and breast, thicken the lung, and kidney and the colon area. For that you have in the morning like painful bones, killed lungs, painful P for prostate, B for breast, K for kidney, T for the thyroid, and L for lungs. They are missing thyroid is also one type of cancer. Thyroid cancer can also spread to the bone. And the bone metastasis can be having different type, plastic, mixed, and lytic. Lytic mean it is going to break down the bone, okay? It will be breakdown of bone. And plastic mean they will be over proliferation on bone. The bone having overgrowth, and overgrowth plastic metastasis will then by prostate or small cell lung cancer. Cancers are going to have an association with ADH and ACTH, okay? It's a very important point. Second site of metastasis is liver. The liver cancer can be spread by the colon, breast, pancreas, lung, and the prostate, but most commonly from the colon and the bone, most commonly from the prostate and breast. For that, also when mnemonic, sometimes cancer, sometimes penetrate liver. C for colon, sometimes stomach, and P for pancreas, and L for lungs. The most commonly the cancer going to liver is colon. And it is scattered throughout liver parenchyma. Whenever the cancer is metastasized to the liver, it will be scattered in the liver parenchyma. Secondly, having a lung. In the lung, the most commonly colon and breast, and second, kidney and prostate. And typically involve both lungs. It is not like that. It is going one side of a lungs. It is involving both lungs when the cancer metastasis to lungs. The last is the brain. The most common lungs cancer to go into brain. Then breast, melanoma, colon, and prostate. For the brain, we are having loss of brain metastasis can kill. Lot of brain metastasis can kill, like L for lungs, B for breast, and for melanoma, C for colon, and T for melanoma, either skin cancer. And guys, 50% of brain tumors are from metastasis, commonly feed in multiple cell circumscribed tumors. And it's all about the metastasis, and in metastasis, the most important point is regarding the bone, like it can be do plastic mesostrative active in which there is overgrowth in plastic and breakdown of bone in lytic metastasis. And plastic is run by prostate and small cell lung cancers. And lytic proton is happening in kidney, colon, and non-small cell lung cancers. Now we are going to start oncogenes. Before oncogenes, I have to tell you two main ways for the cancer treatment. Two ways for the cancer treatment were increase in proliferation, tends to increase in proliferation, but decrease in suppression. And oncogenes are totally related with this component. The oncogenes increase the proliferation of cells, and if these genes get a function, mutation convert the proto-oncogenes to the oncogenes, and these increase the cancer risk. And it requires an image only to one allele of proto-oncogene. Actually, every gene having two variants, okay? If you need mutation or oncogenic effect of any of them, then if one gene is effective, you will get effect. But in tumor suppressor gene, both allele should be affected by the mutation, then you will get effect of tumor suppressor gene. Okay? For the oncogene, it is a property that one allele of proto-oncogene should be diamond to get the oncogenic effect. We having these genes in our list, and already you guys know oncogene having some factors, okay? How can it cause the cancers? By the growth receptors, increasing the growth receptors, increasing the growth factors, increasing the signal transducers, nuclear regulators, and cell cycle regulators. These all are the factors that genes are using to make some cell cancers. First, the growth receptors, growth factors, signal transducers, nuclear regulators, and cell cycle regulators. The thing is that we're having some genes with us that are involving the cancers for the IARC, the anaplastic conformer kinase that goes to langadenoma, EGFR, and HER2. Now, EGFR is epidermal growth factor receptor that's causing the langadenoma, but if you guys know HER2, it's a receptor. One epidermal growth factor 2, my this is called the breast cancer, is overexpression causer. Breast cancer we having the red gene, the red kina, tyrokinase receptor, tyrokinase high is for receptor. And T4 tyrokinase, to read the red color means to first aid book it's giving mnemonic to that thing, okay? And BCR-ABL, the BCR is the plaque point twister region that is going to interact with the ABL, the ABL strand, mutant leukemia via oncogene homolog 1. The BCR and ABL make an interaction, and if you guys know BCR is on which chromosome? Chromosome number 22. And ABL chromosome number 9. The interaction of both genes cause CMN and ALN. Okay? And there's others type like JAK2, Janus kinase 2 that will cause myeloproliferative neoplasm, BRF. BRF is it's a beta-associated fibrosarcoma, and it's called a melanoma. But melanoma also called the one rotational protein that's from B1-6. BRFA causing melanomas. Melanoma is causing by B1-6 and c-KIT, cytokine receptor. It's also called in tumors, MEC-C and actually MEC-Z, proper gene having two varieties, C and N. The C is going to form Burkitt lymphoma, and N is going to form neuroblastoma, if you guys know. The MEC-C having P2 chromosome number 8, and it makes an interaction with the chromosome number 14 of heavy chain due to veterinary increasing immunoglobulin heavy chains, and if we can't Burkitt lymphoma, okay? And the grass GTPase, hence the MAP kinase, can do to which most commonly we are getting the colorectal cancer, colon cancer, in BCL2, follicle and diffuse B-cell lymphoma as a deal. Okay? This all are oncogenes that so important. You have to memorize these all the genes is so important. For exam point of view, the tumor suppressor gene. The tumor suppressor genes are genes that is present at checkpoints and remove all the abnormal cells. But what happening here, instead of mutation, they lose their function, therefore it is called inactive mutation. Already I told you the cancer cells having the two pathways. Increase in proliferation and decreases suppression, decrease in suppression mean the suppression of tumor suppressor gene loss their function due to it increase in cancer cells. And you guys already know if you need if you want to lose the function of tumor suppressor gene, then you have to make defect in both alleles of that gene. Okay? The first gene we are going to study is the APC. The APC is a very important gene that is going to making a colorectal cancer, the starting of the cancer. The cancer start the colorectal benign. It is start growing, that is due to APC. Okay, it is due to inactive mutation of APC. Then there's a BRCA1 and BRCA2. If you guys know, the BRCA1 and BRCA2 still are responsible for the breast cancer and plus ovarian cancer. The main cancer from the BRCA1 and BRCA2 and breast and ovarian cancer saying, if you guys know, the BRCA is present chromosome number 17, BRCA2 is present chromosome number 13. And then you're having some other important genes here. That is HRB1 and P53. If you guys know, it's the very important point between the G1 and cell cycle. In G1 and S1 phases, a checkpoint. In this checkpoint, there is a protein like RB1, and also there's one more factors are TP53. That both genes are responsible for the checking, defense are good. They don't have any mutation, they have no any abnormality, and then send to the process of division. But if this checkpoint is going to lose its function, then it will be great a suppression, a loss of function in resertion. If any cancer, the RB1 is most commonly for the retinoblastoma, osteosarcoma, and TP53 is going to causing multiple malignancy like sarcoma, breast, brain, lung, leukemia, adrenal lymph. It also giving lymphoid syndrome that having the mnemonic of cellular, like sarcoma, breast and brain, alpha leukemia, lung, and A4 adrenal gland. And secondly, how IB1 is going. If you need cyclin kinase dependent, they having cyclin D. That cyclin D attached with cyclin kinase dependent enzymes, so they become inactive. If you remove the cyclin from there, then cyclin will attack on RB1 and become inactive to it by doing the phosphorylation. There are more genes here like TSS1, RT1. The BT1 is for the originated 12 metons keep infected. One thing I want to tell you, the RB1 is present on chromosome number 13 and P53 on 17, and these both are going to block G1 and S phase checkpoint. Okay? So tumor cells, the tumor suppressor genes are responsible to decrease or do the suppression of abnormal cells to stop the growth of cancers. And proto-oncogenes, the proto-oncogenes are responsible for the growth of cancer. Carcinogens, the one of important topic, it is just like a hint. Like in any question, it just mention that hints and that point to you guys in the carcinogen, and you have to diagnose that disease. Now we are going to study about the carcinogen. First is the aflatoxins. Aflatoxins are due to aspergillus. Aspergillus are going to stall in nuts and grains that you eat raw, and these aspergillus release aflatoxin, and that are responsible for hepatocellular carcinoma. Second, alkylating agents. that cause oncology chemotherapy, and the cause is leukemia and lymphoma. Actual clating agents are using for the chemotherapy, in fact, it will cause a leukemia and lymphoma. Also, we are having the aromatic amines that come from the textile industries and tobacco and the smoke, and it will affect the bladder. And we got a transition with carcinoma. We have the arsenic. The arsenic is very important question many times with heat, and it is going to affect three organs, liver, lung, and skin. And this comes from the herbicides, the farm workers metal, melting wood, and preservation. For the liver, it is causing the hepatic angiosarcoma in the lung cancer, and the skin squamous cell carcinoma. Asbestos is mostly found in all roofing material and shipyard workers is the important point. It is exposure to the shipyard workers, and it mostly causes the lung bronchogenic carcinoma and mesothelioma, but most commonly asbestos is causing the bronchogenic carcinoma, that is primary lung cancer. Okay? Then the smart tobacco smoke, the smoking. The smoking not only affecting the lungs, but it is affecting the many of organs like bladder, cervix, esophagus, kidney, larynx, lung, oropharynx, and pancreas, and bladder. It is causing transitional cell carcinoma, cervix, squamous cell carcinoma, esophagus, squamous cell carcinoma, and adenocarcinoma, kidney, renal cell carcinoma, larynx, squamous cell carcinoma. In all of organs are causing the squamous cell carcinoma with adenoma. Adenocarcinoma, okay? The smoking, it's a basic causes squamous cell carcinoma with adenocarcinoma also. And if you talk about the ethanol basically mainly the liver and cause metastases, carcinoma, and praise for the breast cancer, esophagus, squamous cell carcinoma, unknown mutations, leukemia, and the perpetrated carcinoma. Date in nitrosamines that is smoked food, barbecue, you are crazy eating are causing a gastric cancer, intestinal type in the stomach. We're having the radon gases. This is mostly present in the basement of a house. If you guys are not smoking, but you are having the danger of lung cancer, because in the basement of your house, there's a radon radiation that will cause lung cancer. And we know chlorine that is present in PVC pipes. There's also parts of liver, hepatic, and angiosarcoma. If you guys notice in this table, we are going to taking two causes of hepatic angiosarcoma. One is vinyl chloride and second is arsenic. And it's all about the carcinogens. Now we're going to study about oncogenic microbes. It's not only like that. Some carcinogens, genes are involved in cancer, but some microorganisms are highest involved in cancers. And most common is EBV variant, question one. The EBV is causing Burkitt lymphoma. If you guys remember in last lectures, we're done with the Burkitt lymphoma. It's causing by the MYC, an interaction between chromosomes 8 and 14. Okay? And we are also having the Hodgkin lymphoma that is causing by the Epstein-Barr virus, nasopharyngeal carcinoma in primary central system lymphomas. The Epstein-Barr virus, when MCQs are high, having swine euphoric. This one disease caused by Epstein-Barr virus, and this is like the symptom of Burkitt lymphoma. They are having the mutation of 8 and 14. It is caused by a causative agent. Which disease will be caused? Which disease will be affected by same causative agent like EBV is agent? Then which of the same disease will be predicted in that patient that can be nasopharyngeal carcinoma, Hodgkin lymphoma, or primary central system lymphomas? Okay, it can be asked to like that, like saying a simple one disease and saying like with the same agent for disease can be that patient can get. And we're having the hepatitis B and C viruses that will cause a hepatocellular carcinoma. We're having human herpes virus A that will cause a Kaposi sarcoma mostly too. Immunocompromised patient who are taking steroids or affected by human influenza. why did HIV patients also into the AIDS? And secondly, having the HPV, human papillomavirus, usually type 16, 18, 31, 33, and the can cause cervical benign inner carcinoma, head and carcinomas. Actually, they can mostly cause by suppressing the tumor suppressor genes, it having C6 and C7 infected that are going to suppress our tumor suppressor genes RBN. P53, if you guys know it, is present a checkpoint between H1 and S1. And H. pylori, we having gastric adenocarcinoma. The H. pylori is basic cause of gastric adenocarcinoma and marked lymphoma. For H. pylori, we are giving triple therapy, two antibiotic plus one proton pump inhibitor. If it did not effect, we are going to a quadrotherapy in which we are adding bismuth. And the HTLV that is causing the adult T-cell leukemia lymphoma, overflow, quinquilin shows of carcinoma, and ciscos. Soma hematobium is called in a scammers, bladder cancer, how it is going to actually this microorganism lay their egg in the bladder that causes irritation and that transition epithelium convert into scammers, stratifies scammers epithelium, and that is called metaplasia. And due to this metaplasia, we convert to dysplasia in certain scammers cell precancer. You and guys know about the lung smell, bronchi, metaplasia, esophagus metaplasia, and this is one new example you can remember. There's this score. So my hematobium scammers precancer is also example of metaplasia. Because this organism lay the in the bladder that cause the irritation in transition epithelium and then we convert to stratified squamous epithelium. Okay? And it is not a simple thing, the oncogenes. And the cancer cells, if not only producing by mutation, is not only producing by carcinogens, but it can also produce by microbes or microorganisms. We're going to study about serum tumor markers. The serum tumor markers are very necessary help to confirm the diagnosis. We need a tumor reoccurrence in response to therapy. Like if you are given any therapy to a cancer patient, is it working or not? By serum tumor markers, by the range, by the value of their tumor marker, we can assess to response to therapy. We need the tumor reoccurrence and confirm the diagnosis. And it is not a primary cure, but we can use it at for diagnosis, the clinic. But definitely diagnosis made via biopsy. Some can be associated with non-plastic conditions, and these are with some tumor markers like alkaline phosphatase. Like alkaline phosphatase is can be better metastasis to the bone or liver. Any cancer is going to metastasis to bone or liver, and also may of packet disease of bone and seminoma, and secondly, a few ways to LFTs, and LFTs are normal. GCT values like gamma glutamate transferase values are normal. Then you can exclude diabetic origin there. Then you can say this is not a liver disease, can be a bone disease, packet disease of bone, or seminoma. Second, alpha-fetoprotein. Alpha-fetoprotein are embryonic with the component, but it can be present in associated hepatocellular carcinoma, endodermal sinus tumors, yolks, tumor, mixtures, tumor, ectasia, delicantia, neurotube defects. Normally, it is made by fetus. When it is elevated in pregnancies, high level of alpha-fetoproteins can be associated with neurotube defect or abdominal wall defect. But when you get a low value of alpha-fetoprotein, you can be think about Down syndrome. Then we having the city, if giving itself mnemonic like hydathiform, mons, choriocarcinoma, gestation of plastic diseases. And that disease is produced by syncotophor placenta, placenta. If it is an increase in amount, then hydathiform mons and choriocarcinoma, gestation of plastic disease can be predicted. Like CE 153 for the breast cancer and CE 19/9 it for pancreatic adenocarcinoma. Please kindly, CE's PA is a 15 and 3, 19 and 9. The 15 and 3 for breast cancer, and 19 and 4 pancreatic, and 3 of 125 from ovarian cancer, petite ovarian cancer, calcitonin for thyroid carcinoma, and C, that's an important component if the carcinogen antigen is a very non-specific. It for the colorectal and pancreatic cancers. And promograin is mostly neuroendocrine tumors. In promobile like small cell cancers of ADH and increase in ACTH already thought it having the association the small cell lung cancer, the small cell lung cancer having association with ADH and ACTH. These cancers having promograin with your high LDH testicular germ cells in it to use as an indicator of tumor burden. And PSA, it's a prostate-specific antigen. It's the very, very difficult question for which cancer it will be associated. Of course, is it a prostate-specific antigen, then it will be associated with prostate cancer. Okay? And neuron-specific analogs are neuroendocrine tumors, and these all markers are specified and associated with some of cancers. Okay? So all about the tumor markers, and don't forget the tumor markers are just used to confirm the diagnosis, monitor the tumor reoccurrence, and response to therapy that it given to patient, and thirdly, the final and definitive diagnosis just made by the biopsy for the cancer.